um, in their treatment therapy, but they are drugs that are a part of a class of medication that ibuprofen falls into. Now, the doctor might not prescribe ibuprofen, but they may prescribe another drug within that class. And what can happen is that you use that medication, you have an adverse drug reaction because you wouldn't, the person did not properly give that information to the doctor. So doing simple research online can give you all of that information, and you can be like, oh my, I got this medication that has been prescribed. It falls within this class. This information being given here, or I've read here, states or shows that I should not be using this. What do I do? Do I contact a pharmacist, or do I go right back to my doctor and let them know? In most cases, the best option is to contact your doctor so that they can switch your therapy and let you know what you can do in place of it.
Okay. And in terms of going to the doctor, there are certain questions that you can ask your doctor about the medication that he prescribed, or even the pharmacist. What are some of those questions? Ayana?
Hi, sorry, I'm here.
Oh, your internet is going and coming. It's a bit wobbly, and it's affecting us here. Go ahead. Did you hear my question?
Yes, I heard the question. So, and it is a really good question. However, in Guyana, what, especially the public system or in the public sector with private hospitals, with the private hospitals, with public hospitals, what tends to happen is that you go to the doctor, you see the doctor makes a diagnosis and prescribes the medication. You collect the prescription and you go to the pharmacy or the pharmacy area within the hospital. And what tends to happen is that they're the ones, the pharmacists are the ones that tend to be the one counseling you or telling you about your drug therapy. I would think that it would be ideal if the patient does ask the doctor as it relates to what treatment they have been prescribed, why they've been prescribed it. So if the time would allow for a patient to actually speak to their doctor, would also be really good. Of course, the pharmacist would do a wonderful job because we're the specialists in the field as it relates to medicines, the medicines prescribed by the patient. But the patient can also still ask the doctor what the medication is for, or what the medications on the prescription is being used for, how they should be taking it, how the medication should be stored, and how would they know if it is working. So those are the questions. Those are 4 simple questions that patients can ask their doctor. But as I said, within the public system, that part tends to be cut out and left to the pharmacist to do. So if the patient does not get the chance to speak back with the doctor, these are excellent questions to ask your pharmacist, and they all of our pharmacists are qualified. We go through continuing education program every year, so we are updated with the latest and newest information as related to drug treatment and drug therapy. So these information can easily be gotten at your pharmacist's counter, at your pharmacy counter, even if it's within the hospital or outside of the hospital setting at a community pharmacy.
And we know pharmacists seem, there's I think it's a joke that goes around that pharmacists have a special superpower. They know to interpret the handwriting of doctors.
Yes, so true. But shorthand writing is a little bit a part of our training when we actually get to practice on the counter before we actually become an official pharmacist or a licensed pharmacist in Guyana. So that is a huge part of the training. But we do tend to ask our doctors to try to write legible so that we can understand it at ease, because the more difficult prescription is to interpret, it's the more that we're leaving space for errors to occur. So as clearly as possible that the prescription is written for us, it's the better.
In terms of correct doses and like storage of medicine, what can you tell us about that? Because I mean, we might say, okay, not just medicine, supplements, whatever. Because sometimes you say, okay, I can use more and build up myself, but sometimes it's not healthy. So, how important is it that we take our medicine or medication in the correct dosage and store it properly so that we don't have it is not exposed to becoming not fit for our consumption?
Okay, good question again, Rihanna. And that's a two-part question, so I'll answer it in two parts. The first part, as it relates to our dosage. Now, the dosage is important. Outside of the name of the drug, the dosage is an important part of the information that needs to be on your prescription. Now, what tends to happen in cases where there is no strength or the dosage of that medication that is prescribed is that it leaves it into the interpretation of the pharmacist. Now, remember, the pharmacist is not, after the medication has been prescribed by the doctor, they don't have the information as it relates to the medical history, evaluation, and so forth that was done. So, of course, we have general treatment dosage that we can prescribe for the patient with the diagnosis. But the doctor tends sometimes to give specialized or specific dosage for a patient with a specific condition, whether it's advanced or it's not advanced, and then it tells of the length of the treatment as well. So what can happen with patients who, let's say, come to a pharmacy and the dosage is not there, we could, if the pharmacist does not contact the doctor again, we could give a dose that is suboptimal. And suboptimal dose tends to, even though they may bring about a positive outcome as it relates to the treatment, it may not be a positive outcome that will aid in total recovery. So suboptimal doses tend to not be effective in the short term and in the long term. Or it may be effective in the short term, but in the long term, because you have had a suboptimal dose, the chances of you recovering is really slim. Outside of that, let's say, like, for instance, antibiotics. You give a patient a suboptimal dose, or a dose that is lower than what they should have. What tends to happen is that you can either create a mutation of the bacteria or pathogen that you're trying to treat, because one, they will recognize the treatment, and two, they'll build resistance around that treatment. So your suboptimal dose that was given, it did not necessarily treat it, but it only aided in the pathogen recognizing the treatment and now building a resistance. So when you, let's say, now finally get the right dose, your body now has become resistant to it. So that creates a whole other dynamic that you have to go back to the doctor and so forth. It's a waste of time. It's dangerous to your health. And so, and then there is the other side of the coin where the treatment might be dose, or the dosage form, or the dose may be higher than is recommended. And any dose higher than any dose that is more than should be recommended is automatically seen as an overdose. So that is even more dangerous, because one, the person's body might not be able to take the dose at that level for a long period of time, so it creates even more adverse reactions. So it is very important that when we are getting the prescription, or when the prescriptions are being written, the dosage are clearly written. That is the strength of the medication and the amount of time that the treatment has to go or has to be given to the patient, as well as how many times per day and how it is given, if it's orally, if it's intravenously, intramuscularly, subcutaneously, etc. So that's important. The next side or the next part of your question, which is the storage of medication, is also super important as relates to drug treatment and it being effective. And there are different temperatures at which the treatment or dosage forms are stored at. So there's the cold temperature, which is between 2 to 8 degrees Celsius. There is the cool temperature, which is 25 degrees Celsius. And then there's regular body temperature, which is 37. In most cases, when you check on your dosage form, you'll see either store in a cold place. And when you see that, it's 2 to 8 degrees Celsius, or store in a cool place, which is 25 degrees Celsius. And this is important because what tends to happen is that the elements of nature, like heat and cold, can disrupt their dosage form and make it ineffective as it relates to treating you. And what I'm saying ineffective is that some dosage form tends to separate out. And if it's, let's say, a solution, that should not separate out at any time. So when a solution separates out, we already know that the dosage form or the medication is now, it should not be used. If it's a suspension, well, then that's okay. If it separates out, we usually tell patients to shake it well and then use. But for solutions or medications like tablets that we start seeing, it's cracking or it becomes discolored, because of the elements of nature, those tend to be ineffective, and it can even transform into an even more dangerous drug that can affect the person adversely. So it is important that we know our temperatures and we store it at those temperatures. I know that some persons tend to store the medications in their cars, store the medications on a table under a bowl or stuff like that. It is advisable that when we say cool, we put it into a cool place within your home, either into a cupboard or a simple drawer, but it must be cool and not a place that the sun is beating on a lot and it becomes very hot. And when we say cold, we would ask if you were to store it in your fridge, you store it between the 2 to 8 degrees Celsius and closer to the back of the fridge, and not clustered with other foods and stuff that you have in the fridge. So that's it.
So you probably would have touched on a nerve for a lot of people out there, because I know that's common, the storing of medication on a table. I've seen it even in at home. Like, they just put it down there, and it's not really safe, because I would have asked you about dosage and so on, but they have children. When you put these medication, what happens then? There's a scenario you have, and a child takes the tablet, then you have a situation on your hands. So we'll just take a short break, and when we come back, we're gonna go into a bit more on some of the other things about how often it is that people commonly misuse their medication. So let's go to a break quickly, and when we come back, we'll have more from Miss Ayanna Blair, pharmacist, on how to use your medication correctly.
The COVID-19 vaccine gives us hope for a healthier tomorrow. Have you received your shot yet? The Regional Health Services in Region 2 invite you to get vaxxed and get a chance to receive a COVAX hamper. A what? A COVAX hamper. When vaccinated, you will receive a coupon, and drawings will be done weekly at the Suddy Health Center and broadcast live on the Regional Health Services Facebook page on Sundays. Get vaccinated and get a chance to be one of 4 lucky winners of a COVAX hamper. Pomeroon Supernam, fighting COVID-19 for a safer region and safer Guyana.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burbies 99.5 FM. Kaieteur Radio.
Welcome back to Your Health Matters. I'm your host, Rihanna Ramsey, and we have with us today Miss Ayana Blair, a member of the Guyana Pharmacists Association, and she is a local pharmacist for over 12 years. She has been talking to us about the importance of using your medication correctly. Ayana, are you back?
Yes, I am here.
So we've been having some trouble with the internet earlier. So if you notice there have been breaks in between. It's not our fault. The internet is going and coming, and we're so sorry about that. However, we've discussed quite a few we've discussed. She's brought a couple of tidbits on how you can take care of yourself better in terms of taking your medication, and we're going to go into our next set of questions. And Ayana, as it relates to how common is it for persons to misuse their medication? As a pharmacist, in your capacity, is it common for persons to come to you and say, "Oh, I'm using this tablet," or "I'm using this this supplement," and then you have to correct them on how to use it? Is it common?
Yes, Rihanna, actually is quite common. And I think what tends to happen with persons is that when we start a drug treatment and we our bodies tend to start feeling better, we tend to, some persons tend to stop the treatment because it's like, something, I'm feeling better, so I guess it's all I guess what was ailing me is gone, so I should just stop, or I wouldn't have to take, or some of them say, something, instead of taking a tablet 2 times a day, I'm already feeling better, let me just reduce it to 1 time a day. I should be this should be okay. And that is definitely not okay, because as I had mentioned in the earlier conversation, there is optimal dose, which is a dose that you should be taking, and that is the times of the day that you're supposed to be taking it, which if it's once daily, twice daily, 3 times daily, the amount that should be taken overall, and the length of time for the treatment, that's optimal. When you're having a suboptimal dose where they stop taking the medication how they should, or they don't take the medication at all after they've started feeling good, we have explained that is dangerous, and patients should, or persons taking medication should try to avoid at all times. And then there is the other extreme, where persons, once they would have started treatment and they haven't seen anything happening, and they're not feeling any better after 2 or 3 days of the treatment, they tend to double up the dose or triple the dose, thinking that something, maybe if I increase the dose, it's going to be better for me and I'm going to get a better outcome. And again, I would have explained to you that be considered overdose, and that is even more dangerous because one, your body might not be able to take the treatment at that dose and at the length of time that you're taking it as well. So it is important that us as pharmacists, when we find that our patients or persons that entrust us with this information is not using the medications correctly, we stress on them, or we emphasize the importance of using optimal dose.
In terms of medication and misuse, what are some of the commonly misused medications in Guyana? Because we have a number of over-the-counter drugs that are popular among us: ibuprofen, Advil, those sort of things. What are some of the commonly misused over-the-counter drugs, and even probably prescription drugs? Okay,
so as it relates to the common misuse or overuse, I'm going to just touch on 2. One is the antibiotics, prescription medications that I do know that some pharmacies do sell over the counter. That is, without a prescription, they sell over the counter. And then there is codeine phosphate containing syrups or compounds. So let's look at the antibiotic section of it. Patients would call it the black and red, or red and yellow, amoxicillin or ampicillin, if you know it by its scientific names. What tends to happen is that a person get a cold and they run to the pharmacy and they ask for antibiotics. And some pharmacies do just sell it to the patient without even finding out or evaluating if the medication is the right medication for the symptoms or the ailment that the patient has. So one of the widest or most misused medications is amoxicillin and ampicillin in this country. And
those are antibiotics, right?
These are antibiotics, yeah. What this misuse has done is that it now has many bacteria have now become resistant to it. What this misuse has done, many bacteria that we're treating now have become resistant to it. So we gotta now switch patients from just a regular amoxicillin or ampicillin to other classes of drugs to deal with ailments that traditionally were treated with amoxicillin and ampicillin. So that's one of the widest and most misused. Person get a headache, they come from amoxicillin. Person say they want to do a clean out, they come from amoxicillin. A person have a foot pain, they come from amoxicillin. Belly ache, amoxicillin. It seems like the going medication right now. Another one, and this tends to be in over the counter compounds. We have the Tossidril cough lintas, that's a red box one, with the codeine phosphate a part of it, or just pure codeine phosphate liquid in the bottles. Now that seems to be morphing into a recreational drugs among our youths these days, where they're chasing it with alcohol and Sprite and so forth. And that again is one of a very popular medication. Tossidril we know should be just used for your regular cough, colds, and flu-ish symptoms, are now being used as a recreational drink. And this should not be, because if you understand the adverse effect of the codeine phosphate, you would know that entering in your body over a long period of time can also or can lead to addiction. And quite a few of our youth are actually addicted to codeine phosphate now because of the euphoric feeling that the medication tends to get. This elevated feeling of strength and happiness and bliss. But the reality is that it's not healthy to be consuming this medication outside of an ailment that it needs to treat. And if you look at the medical information for codeine phosphate, it's actually an antitussive. It's supposed to be used as a cough suppressant or something to reduce coughing, and not to be used to create euphoric moments at parties. So those are the two that we as pharmacists, we are still trying to regulate it and monitor how we give it to patients and so forth, and it should be more regulated in Guyana.
Oh my! And it's easy for youths to get their hands on it because it's over the counter.
Yes, it is easy because I visited quite a few regular shops in the corner stores that isn't a pharmacy, and you can find the Tossidril